Hello, collision tumors. What is a collision tumor? Well, the best definition could be two or more benign and or malignant tumors combined together. So two different lesions that are belonging together. And this kind of collision is most probably by chance. So a casual rather than a causal phenomenon. So it's something which is not really related to the a common denominator, but it's just a by chance phenomenon. I just want to share with you a recent patient that had two similar lesions, as you can see, two similar lesions which are showing basically the same morphology. So a combination of brown areas and darker areas. So especially the lesion on the left side is showing a kind of blue gray structureless ovoid area in the context of a brown pigmentation looking like a solar lentigo. So at the end of the day, the lesion on the right was melanoma, which was expected, and the lesion on the left, which was thought to be a very unusual, suspicious lesion, was a collision tumor, a solar lentigo plus a blue nevus. Could it be that there is a, let's say, a common denominator between the solar lentigo and the blue nevus? No way. It's just a by chance phenomenon. So the world of collision tumors is very huge. So we can have a combination of many types of lesions together. But I want to let's say concentrate a little bit on the most frequent collisions. The collision number one. The collision number one is here an example. As you can see here, it's a brown pigmented papule, which is showing in the center a bluish to reddish area, and at the periphery a kind of brown pseudo network. So this is one of the most common collisions that we can see in our practice. So it's a collision between a seborrheic keratosis at the periphery and a basal cell carcinoma in the center. In this particular context, the lesion was very difficult to be assessed, but in this other lesion, as you can see here, we can see clearly the two lesions combined together. So on the right side, you see the beautiful criteria of a basal cell carcinoma, typified by arborizing vessels, ulceration, and so on. And on the left, we see an area, a spot of a seborrheic keratosis lesion with miliar-like cysts in the center and a little bit of reticular lines at the periphery. This is again a quite difficult combination of a basal cell carcinoma and a seborrheic keratosis. In this case, the basal cell carcinoma is showing a more compact blue-white coloration, while the seborrheic keratosis on the left is more clearly visible with multiple miliar-like cysts and a little bit of irritation at the bottom side of the lesion. Collision number two is this one. This is also very frequent. We see quite regularly pigmented brown lesion, and here we see a beautiful combination between what? Between a seborrheic keratosis on the right side, again a seborrheic keratosis, and a reticular lesion on the left side. What kind of reticular lesion? A reticular nevus. So the second most common combination collision tumor is a seborrheic keratosis plus nevus. Common nevus, reticular nevus. Here we see another example. As you can see here, there is a larger area of a reticular nevus, and on the left side, on top, we see let's say a spot of a seborrheic keratosis with multiple milia and commiddle-like openings. Another example here, by the way, this is a very suspicious lesion from a clinical point of view, but dermoscopically you can see these beautiful multiple commiddle-like openings, and on the left side just a rim of a reticular network. So again, reticular nevus combined with a seborrheic keratosis. Okay, so seborrheic keratosis are very common, so we expect to find them colliding with other lesions, but also nevi are very common, and therefore also nevi can be combined not only with a seborrheic keratosis but also with, in this particular case, with a beautiful hemangioma. You see the brown network of the nevus and the nodular component composed of red-blue lacunes, which are typically seen in an hemangioma. So nevus plus angioma. Okay, this is another example. You see an hemangioma on top and the reticular nevus at the bottom side of the lesion. Collision number 4. Let's have a look. This is also quite common. Here you see a lesion that in my estimation could be a dermal nevus, but it's not only a dermal nevus. Of course, on the left side of the lesion we have a dermal nevus, but what about the right side of the lesion? This is we see a few sharp in focus vessels. So this is a combination between a dermal nevus and a basal cell carcinoma. So also basal cell carcinomas are very, very common. Therefore, they can be found together with colliding with other lesions. And in my view, this is the most funny looking collision lesion. Well, actually, it's a combination of 3 lesions. An hemangioma on top, which is a little bit disconnected with the rest of the lesion, which is composed on top of beautiful arborizing and sharp in focus vessels, so BCC, but at the bottom side of the lesion we see remnants of a dermal nevus, compound, predominantly dermal nevus. Thank you for your attention.